Well-being. Being well. Pain. Pain is a complex, multidimensional experience that arises from the interaction of physiological, neurological, psychological, and contextual factors. While often perceived primarily as a physical sensation, pain is shaped by cognitive appraisal, emotional state, and prior experience. Understanding pain as an integrated process rather than a purely sensory event is essential for effective management and long-term adaptation. At the physiological level, pain begins with nociception, the process by which specialized sensory receptors detect potentially harmful stimuli such as extreme temperature, pressure, or chemical irritation. When activated, nociceptors transmit signals through peripheral nerves to the spinal cord, where initial processing occurs before the signal is relayed to the brain. Multiple brain regions contribute to pain perception, including the thalamus, which acts as a relay center, the somatosensory cortex, which processes sensory qualities such as location and intensity, and limbic structures that assign emotional significance. Pain may be experienced as acute or chronic. Acute pain typically arises from injury or illness and serves a protective function by signaling tissue damage and promoting avoidance of further harm. Chronic pain persists beyond expected healing periods and may result from ongoing inflammation, nerve injury, or maladaptive nervous system changes. In chronic pain, the protective function of pain is often diminished, and the experience itself becomes a source of ongoing distress and functional impairment. Neurochemical processes also play a significant role in pain modulation. Neurotransmitters such as substance P contribute to the transmission of pain signals, while prostaglandins released by damaged tissue increase nociceptor sensitivity. Endorphins, the body's natural analgesics, can reduce pain perception by inhibiting signal transmission within the nervous system. The balance among these chemicals influences both pain intensity and persistence. Psychological factors strongly shape how pain is perceived and experienced. Emotional responses such as fear, anxiety, or distress can amplify pain, while calm and perceived control may reduce it. Cognitive appraisal, how individuals interpret pain, significantly affects its intensity. Catastrophic thinking, in which pain is viewed as overwhelming or unending, tends to worsen pain experience, whereas adaptive coping strategies can mitigate its impact. Attention also influences pain. Focusing intensely on pain can heighten perception, while distraction may reduce it. Pain perception is further influenced by expectations, beliefs, and contextual meaning. Anticipating pain or believing it to be dangerous can increase sensitivity, while positive expectations and confidence in coping ability can enhance tolerance. Psychological conditions such as anxiety and depression frequently co-occur with chronic pain and may contribute to a reinforcing cycle in which emotional distress intensifies pain and pain, in turn, worsens mood and stress. Neurologically, pain involves both ascending and descending pathways. Ascending pathways transmit pain signals from the body to the brain, while descending pathways allow the brain to modulate pain at the spinal level. These descending systems can inhibit or amplify pain based on factors such as emotional state, attention, and prior learning. The gate control theory of pain highlights how competing sensory input and cognitive factors can influence whether pain signals are amplified or dampened before reaching conscious awareness. In chronic pain, persistent activation of pain pathways can lead to central sensitization, a condition in which the nervous system becomes hypersensitive to both painful and non-painful stimuli. Maladaptive neuroplastic changes may occur, making the brain more efficient at producing pain signals even in the absence of ongoing tissue damage. Neuroinflammation and altered connectivity among brain regions involved in emotion, sensation, and motivation can further entrench the pain experience. Effective pain management requires addressing both physical and psychological dimensions. Interventions may include medical treatment, physical therapy, and lifestyle adjustments, alongside psychological approaches such as cognitive behavioral therapy, mindfulness-based strategies, and stress regulation techniques. These approaches aim not only to reduce pain intensity but also to restore function, improve emotional regulation, and interrupt cycles of fear and avoidance. Pain is best understood as a dynamic process rather than a fixed signal. By recognizing the interplay between physiological mechanisms, cognitive appraisal, emotional response, and neuroplasticity, individuals and clinicians can adopt more comprehensive and compassionate approaches to pain management. Such understanding supports resilience, adaptive coping, and improved quality of life even when pain cannot be fully eliminated. Pain tolerance, adaptation, and psychological well-being. Pain tolerance refers to the capacity to endure or manage pain, and it can change over time through physical, neurological, and psychological adaptation. The human body and nervous system possess a remarkable ability to adjust to repeated or prolonged pain exposure, which can result in reduced perceived intensity or increased ability to function despite discomfort. This adaptation does not imply the absence of pain, but rather a shift in how pain is processed, interpreted, and regulated. At the physical level, repeated exposure to painful stimuli can lead to desensitization of nociceptors, the sensory receptors responsible for detecting pain. Over time, these receptors may become less responsive to the same stimulus, effectively raising the pain threshold, the point at which sensation is perceived as painful. This form of adaptation is commonly observed in individuals who experience repeated physical stressors, such as athletes or those engaged in physically demanding occupations. Neurologically, pain adaptation is supported by neuroplasticity, the nervous system's capacity to reorganize itself in response to experience. With ongoing pain exposure, neural circuits involved in pain processing may adapt in ways that reduce signal amplification or enhance inhibitory control. Endogenous pain modulation systems, including the release of natural opioids such as endorphins, can become more effective, helping dampen pain perception. While chronic pain may initially lead to central sensitization, heightened responsiveness of the nervous system, some individuals experience partial desensitization over time as regulatory pathways strengthen. Psychological adaptation plays an equally important role in pain tolerance. Cognitive coping strategies, such as reframing pain as manageable or temporary, can reduce the emotional distress associated with pain and make it more tolerable. Emotional resilience and effective stress management decrease fear-based amplification of pain signals, supporting greater perceived control. Behavioral adaptations, including improved posture, ergonomic adjustments, pacing, and gentle exercise, further contribute to functional pain management. Practical examples of increased pain tolerance can be seen in populations exposed to repeated discomfort under controlled conditions. Athletes and military personnel often develop higher pain tolerance through training that combines physical conditioning with psychological preparation. Similarly, individuals living with chronic pain conditions may develop adaptive strategies that allow them to function more effectively, even when pain persists. Increased pain tolerance can influence psychological functioning in complex ways. Many individuals develop greater resilience and confidence in their ability to handle adversity, which may generalize to other life challenges. Familiarity with pain can reduce anxiety associated with it, leading to a calmer and more accepting response. Neuroplastic changes associated with improved emotional regulation may further enhance tolerance for both physical and emotional discomfort. However, adaptation to pain is not universally beneficial and requires balance. Chronic pain exposure without adequate support can contribute to negative psychological outcomes, including depression, anxiety, emotional numbing, or learned helplessness, particularly when pain is perceived as uncontrollable. Habituation may reduce emotional reactivity, but in some cases, it can also lead to detachment or diminished emotional responsiveness as a protective mechanism. Effective pain management therefore benefits from a holistic approach that addresses both physical and psychological dimensions. Combining medical care, physical therapy, cognitive behavioral strategies, mindfulness practices, and social support helps maximize adaptive pain tolerance while minimizing adverse mental health effects. Psychological support is especially important for maintaining motivation, emotional well-being, and a sense of agency in the presence of ongoing pain. Pain tolerance is best understood as an adaptive process shaped by experience, learning, and regulation rather than a fixed trait. Through physical adaptation, neural reorganization, and psychological coping, individuals can increase their capacity to live meaningfully alongside pain. When supported appropriately, this adaptation can improve quality of life, resilience, and emotional stability, even when pain cannot be fully eliminated.